to Touchstone Coaching. My name is Annie Spence. I'm a certified strength and conditioning specialist, and I have my degree in kinesiology. I'm also the owner and operator of Unbreakable Strength Co., and this is my principles approach towards client assessment, programming, and progression. What is a touchstone? A touchstone is a test for the criterion or the qualities of a thing. Back in the day, a touchstone was literally a stone used by people testing gold or silver, the quality of precious metals, based on the streak that would be produced on that stone. And so a touchstone is something that we can go back to and test if we have, true gold, if we're making true progress, or if we're not really moving towards the direction we would like to. The principle of touchstone training is that it allows us to train towards a desired quality while consistently testing and retesting that we are authentically developing that quality. How do we establish our qualities, right? We have to do an assessment. We have to establish a baseline. So the first thing that I like to do with clients is a type of table test. So we want to see basic skeletal competency. I want to see where you can flex and extend. I want to see where the client can internally and externally rotate. I want to know if their skeleton struggles to move in certain positions so that I know what to look for when I see their movement off of the table. The next thing that I look at is observable motor competency. So how do they move without my coaching input? If I say, do a set of squats without giving them information on how to execute those squats, what are the things that they do on their own? Or what are the things that the behaviors that they trend into without input? And what of those are constructive and what of those are unconstructive? And so we're really looking for, their capacity to execute things with quality, looking for what those limitations are, and then we're going to test and retest those qualities over time as we work to improve them. The next thing that we're going to assess is fundamental strength. So, a lot of the times if I've got somebody coming in and they've never done barbell lifts before, taking a 1 rep max on their barbell lifts doesn't really give me that much information because they are too underskilled at it to express true maximal strength. And so I like to look at slightly simpler movements. So how many quality push-up reps can you do? If we have you do goblet squats and we increase the weight kind of acutely in a session, at what point does that anterior loading start to decay that squat pattern? So we kind of look at, where we see decays, where we see the upper limit thresholds for their capacity to execute things well, and then we're going to use that as an opportunity to know how intense to make those initial exercise sessions. The last thing about our assessment is we're not using this as an opportunity to pathologize or diagnose. So as coaches, we are not clinicians. We can't legally diagnose people. If somebody tells you that they have pain, of course, then you need to refer out for pain treatment. But really, it is very common to see slight deficiencies in rotation, slight deficiencies in flexion and extension. It's not pathological. It's oftentimes a byproduct of just the way that person has lived their life, but it may not be constructive for what we want to do with them as an athlete. So we don't want to say, oh, I'm very concerned, your hip internal rotation is just terrible. We're not using this as an opportunity to make our client feel worse. We're just using it as an opportunity to garner information on what we can improve. How do we determine priorities from that assessment? So we want to start out with exercises that the client can execute pretty well, that they can improve on. So we don't want to pick exercises that are vastly out of the range of what somebody's current skill or fitness level is. This, giving them things that they can execute confidently, that they can progress, gives them an opportunity to feel encouraged and to feel positive about their training, which is ultimately going to lead to better progress than crushing them with things that are too hard too soon. We also want to improve movements that they are incompetent at. So there are going to be things that you will notice in their assessment that are directly limiters for them. What are their lowest hanging fruit, right? If somebody's resting heart rate is very, very high, we can improve a lot of their athleticism by simply getting their resting heart rate lower. If they're incredibly slow, we can ask them to do explosive movements. If they really struggle with tightness or mobility, then we may start out every session with some type of more focused mobility work. So we just want to take whatever that thing is that's standing in their way between them and the next step and remove it and give them exercises that will help them remove that low-hanging fruit. We also want to select exercises based on the outcome we want. So what system is being addressed? Are we assessing, are we trying to get adaptation out of our skeletal muscular system? Are we trying to get adaptation out of our cardiovascular system, et cetera? And so we want to make sure that the exercises we're selecting are in line and the progression models that we're selecting are in line with the outcomes that we want. The other component to this is communication, right? As we're assessing a client, we want to reinforce to them that, hey, we are using this information so that we can create the ideal intervention for you. And so I'm really open to, explaining things to client, answer questions for them. You don't have to make things overly complicated. You don't have to use flowery anatomy and physiology language, but your clients are intelligent people. They are also part of the coaching process. The best coaching that's going to occur is an athlete that's empowered with knowledge about what's going on in their body. So definitely, as you are selecting these things, take the time to communicate with and explain to your client why you're doing what you're doing and how that helps them, and why it's important that they do what's written for them, because it is going to help them in ways that they can understand. What do we do from here? Well, we've done our test, we've done our assessment. Now we have to train. We're going to have a duration of training sessions or homework that client does on their own, and then we want to be able to retest those metrics that we tested at the beginning. I typically wait until 8 weeks or more. Of course, that first kind of 4 to 8 weeks of training is mostly skill improvement, mostly neurological adaptation, some metabolic and cardiac adaptation. And so I really like to wait until we've had interventions going for, 8 weeks or beyond to really have an assessment of how much their body has changed and been impacted by those training methods. So below is just a list of some of the other things during an assessment that we can test. These are all metrics that may be important to an athlete or a Gen Pop client. We can test things like a person's reactive strength index. We can test rep maxes once an athlete is more skilled. We can measure their resting heart rate. You can measure resting heart rate almost every day, right? You can test max power output, throw distance, VO2 max, etc. So all of the things on this list are things that you may use in more advanced testing methods or in more specific athlete testing methods to progress over time. When we select exercises, of course, we are selecting exercises based on a stimulus that they provide. So what are the types of stimulus that we can offer a client? We can give them neurological training stimulus. This comes in the form of motor learning, skill acquisition. In this part, we're involving the basal ganglia, the cerebellum, and the motor cortex of the brain. So motor learning is very important, skill acquisition is very important, and a lot of our training and our maximal strength effort, our explosive effort, comes from neurological adaptation. We can also train tissue. So we need tissues that have the structural integrity to hold up to the forces and the positions that we're putting them through. So tissue training allows us an opportunity to improve the qualities, the health of that tissue, to assess our skeletal structure and positioning, and to attempt to make changes to, how we're able to manipulate our tissue over our skeleton over time, our muscular development, our tendon health, and more complex things like the series elastic component of the body are things that are involved in that tissue stimulus when we train. When we look at metabolic adaptation, we can separate metabolic adaptation. Evan Picon is a physiologist who has created, or rather expanded on, some of these concepts more publicly. So if you're looking into more information about metabolic adaptation, he's certainly somebody I would recommend. But in his model, he talks about utilization and delivery as two primary types of metabolic adaptation. So utilization being the question of, is our target tissue able to turn over energy and cope with waste efficiently? So somebody that struggles with utilization may be a boxer that, catches a pump in their arms before they're able to continue a fight, right? So if you get a pump, your shoulders blow up, you're going to slow down. Those muscle tissues aren't able to, either metabolize or to clear blood, maybe blood pools in them, and you become slow. So utilization is important. The other thing is delivery, right? So is our respiratory system able to exchange gas effectively? Do we have a healthy or unhealthy lung? Is the body able to redirect blood flow to working tissues via, capillary vasodilation? And is the body able to extract blood and waste product from tissue that has been working? So muscular contraction can create occlusion, and we want athletes to be able to deal with that occlusion. The last thing that affects an athlete's delivery is their capillary density. So when we look at people with very large muscular structures, we usually see slightly less capillary density. And then we look at people like marathon runners with less muscle tissue, lots of cardiovascular capacity, and we see really high capillary densities in them. So depending on the type of person that you're training and what their goals are, thinking about exercise interventions that improve capillary density may be something that's worth thinking about. So we hear this concept of progressive overload in training. I like to describe this to clients as progressive overstimulus. I think the term Load can imply this, that we're kind of just adding weight constantly all the time. And anybody that's trained for any duration of time knows that we cannot just add 5 pounds a week indefinitely and improve. Certainly that works for new people and for a time, but really all exercise is just trying to progressively improve the stimulus that we're providing, and that doesn't necessarily always relate to poundage on a bar. So we can progress stimulus with exercises by changing our center of mass, manipulating our center of mass, by reducing the time that we're able to complete a task in, or increasing the time that we are able to do a task for. We are able to provide progressive overstimulus by doing things at higher frequency, or maybe we have to pull down to a lower frequency as we drive our intensity up. We can improve range of motion, a person's ability to do a certain volume or density of work within a time, the complexity of a skill, the maximal number of reps they're able to do on an exercise, how much velocity or acceleration they're able to produce, how high they can do something, how high they can jump, how far they can jump, or how long they can do a given or desired task for. So really, these are all examples of things which we can progressively train over time to provide that progressive overstimulus and drive adaptation. Intent is the engine of our progression. So we have to know, kind of going back, I know we've reiterated this throughout the presentation already, but intent is the engine of progression. Our intent is the thing that provides the rationale for our training intervention. Why am I doing what I'm doing? It gives us something to explain to the client of why the hard stuff that we're asking them to do is worth doing, and why we're worth listening to, and how that's going to improve their training over time. And it gives us a roadmap for where we can expect to be on a timeline with our training. We want to ensure unification and a forward direction of all of our training towards our goal and our training intervention, and we want to use the client's efforts most kind of to the most effect, right? You have clients, they come, they work hard, they deserve a training program that gets them where they want to go. So how do we organize this stimulus over time? We can organize our training. If we look at conventional kind of periodization programming, we're going to see these things referred to as macro, meso, and micro cycles. This is really a complicated term for the whole year, months, weeks, and days, right? Just how we break up time. Of course, macro could be a long-term training plan, and this provides us a broad scaffolding and direction, but doesn't necessarily tell us what we're doing day to day. So a macro plan for an athlete may be a 1-year model, it may be 2 or 3 or 4 or 5. So that macro is just our largest rendering of our plan and our training outline. Our mesocycle is typically our kind of middle term training program. So these are usually things that we break our training up into segments. We maybe have, if somebody's a competitive athlete, we have preseason, season, postseason. If somebody's a Gen Pop client and they just like training and they're just trying to feel better and move better, then maybe we take those times to focus on things like explosive capacity or maximal strength or hypertrophy. We can kind of separate those into more traditional types of cycles. And then we have the microcycle, which is the really granular view of our training week. This tells us the exercises we're doing, this tells us our training days, and gives us more granular information about our program. It's very important to stick to a plan, right? Modification is sometimes necessary. We get sick, we get hurt, we travel, or our equipment access changes, but we want to make sure that if we're substituting exercises or if we're modifying training, that we are selecting modifications and substitutions that maintain our training intent. So we want to avoid being reactionary, right? And either increasing or decreasing our training stimulus really rapidly. So sometimes as we start training, if a training program's hard, we're going to feel a little tired and a little extra sore at the beginning. It doesn't mean that we need to immediately reduce our volume. Sometimes we have to stick with things for a time in order for them to feel good. We also want to avoid, if we feel like we're not making progress fast enough, acutely over increasing our intensity and our volume because we're impatient. So create a plan, stick with it. After you've been with it for a couple weeks, then make some assessments on if what you're doing is working or not, and if you need to change. But I typically wait for several weeks before I make modifications. So here's an example of a client. At the point in time that Bill and I were training in this photo, when this photo was taken, he'd been training for 6 years. During our initial assessment, Bill really struggled to reach his hands overhead. He had very, very painful left shoulder pain anytime he was in a kind of a push-up position or supported on his hands, or anytime that arm reached too far overhead. His spinal position was very stiffly fixed in flexion in his pelvis and quite strong posterior tilt. So we do see a little bit of that still at the bottom position of his squat in this image. However, compared to when we started, the severity is so vastly reduced. It's really probably 70 or 80% improved here. At that point in training, he was not able to, he could passively extend his hip, but active hip extension in the form of something like a Romanian deadlift was always substituted with lumbar movement. And so that is also something that we have worked a tremendous deal on over time. In this photo, you can see he's successfully in a deep squat with additional weight. This is not something that he was capable of when we started. This is something that we have worked on over time through direct tissue interventions and direct movement interventions. A program example. So this is, a client that is in his 70s, and we are really able to train him very much like a conventional athlete, right? So we do mobility work, we have some explosive work that we do, and then after our kind of explosive, more athletic oriented work and our mobility work, we get right to our primary lifting. So I think that, of course, certainly with certain special population clients, we have to make modifications, but I think it's also important to remember that bodies of all ages adapt to training stimulus, and that it's still important just because somebody is, 60 or 70 or 80, it's still important that they experience the full spectrum as much as possible of our training model that we can provide. So we want to provide people with explosive work, cardiovascular work, metabolic work, mobility work, and that can be adapted to anyone of any level. So just because your client may be of a special population or somebody with more unique training needs doesn't mean that you can't take very traditional athlete programming and apply those principles to that athlete for their benefit. Here's a photo of Bill at the Sunflower State Games a few years back. He is currently the state record holder for bench press and deadlift for men 75 and older in the 185-pound weight class. So I think that, again, everyone has the capacity to become an athlete through Touchstone Coaching. We have the capacity to test and retest and really ensure that we as coaches are providing our clients with things that move them towards their goals. And in this case for Bill, it was to become the state record holder in bench press and deadlift, and that is exactly what we have accomplished with Touchstone Coaching. If you have questions or comments or further thoughts, anything that you'd like to know about exercise assessment, athlete programming, and training, please feel free to leave a comment or shoot me a message, and let's talk about it.